want to say first and foremost, again, we all value the nature of education. I don't think any of us, including the officials at MCPS or anyone, would disagree that the value of in-person education is more beneficial than your folks are at home. That isn't a perfect world, though. Our world isn't perfect, and it's heavily influenced by COVID in this setting, which guides us and determines how we will move forward. As I referenced, the decision to close schools was made when we were talking about an average of 4 cases a day. We're still somewhere between 70 and 80 cases a day. And in the particular setting where we're seeing increases in the percentage of young people who are impacted and infected with the virus. So these are the real world epidemiology and surveillance-based realities that we live in as we try to negotiate and figure out these strategies as we move forward. Now, the type of experience and exposure in a school setting is different from some of those other activities. We have been very careful in terms of the activities that we have allowed, so to speak, in terms of our phases of reopening, to identify things that minimize risk of exposure, facilitate physical distancing, where we think they are lower risk in terms of type of exposure, duration of exposure, et cetera. When you're talking about school settings, you're talking about being in an enclosed indoor space around a number of people for an extended period of time. And so our colleagues at MCPS have drawn up lots of different scenarios and policies and plans that would allow for that to happen safely. But we're not at a point where the viral burden in our community is to be able to approve having those types of environments where there are extended periods of exposure, there are closer contact points, which do increase the risk of transmission for students as well as staff members.